Good day, everyone. Welcome to our first official episode of Sickle Cell Warriors Health in Color podcast. My name is Jaden Ido Akinyasade, and I'm joined by my beautiful co-host.
Hello, my name is Hannah, and Hannah is we're here with a beautiful lady today. But before, in case you're not following us, please go and follow us on our YouTube channel, Health in Color Pod, and our Instagram, SSW Health in Color. So we're here to talk about diseases in the BEM community that affect literally Black people. Yeah, please go follow us. And we have a very beautiful woman here with us. I'll let her introduce herself.
Hi everyone. I want to appreciate the Health and Color people that invited me here today to join them. My name is Fumilayo Oladineko. I'm actually one of the sickle cell nurse, and my title is Advanced Clinical Practitioner in Omartin Hospital. Nice meeting you today.
Nice meeting you. Thank you for coming.
Welcome. I appreciate you. I feel very, very lucky today because I'm joined by two beautiful women. So I feel very blessed right now. Thank you, everyone, for joining. Please, as Anna had already said, like, subscribe, comment, and also send your questions in. We'll have our addresses on the screen. We have a very huge topic to talk about today. As you know already, this is the SSW Health in Color. It's called Sickle Cell Warriors Health in Color podcast. So our first official episode is talking about sickle cell disease. So we'll go right into it. This is why we've got a professional here to speak on it. Technical terms that we don't know, or there's things that we're supposed to know that we don't know about. She can explain it for us today.
The truth, the myth.
That's right. We want to use this to break down barriers, break down stigmas, to break down myths. We also want to inspire and motivate people that are watching, and also have a better understanding of what this condition that affects one in about three newborn BAME people in the UK as well as all over the world. It's a huge disease that impacts the life of a lot of people. So we'll get right into it. What is sickle cell disease?
I think sickle cell disease is just a simple term of it's an inherited blood disorder that it's not contagious. It's something that has to happen between two parents. For someone to have a sickle cell disease, two parents have to come together to have that sickle cell disease. However, when we have sickle cell disease, that's why we call it as inherited blood disorder that affects our red cell becoming sickling, that cause pains, damage of organs, and affect life conditions sometimes. And majority of all, sometimes it causes an infection in the sickle cell patients. But when we are talking about sickle cell disease, it's not just by one person having the disease without parents being passing it on to their children.
Okay.
Right? So everything have to pass from the gene, from the both father, from both mother, have to pass it into their child.
Okay.
We are talking about the family, which is parents who have a trait of sickle cell, and another father that have a sickle cell trait. So when they marry, it is true the research said, 25% of it, of the offerings, we have sickle cell. And while another 25%, we have normal child.
Okay.
And the 50%, we have a normal, carrier like the parents. But that is what the research says.
That's right.
But sometimes it's not like that.
Okay. Before you continue, how does having a trait differ to having the disease?
Okay. The trait is an abnormal disease as well, but the severity is the only one that between them, because the sickle cell disease is the severe one.
That's right.
It's a life-threatening condition. While the sickle cell trait, they are just a carrier.
Okay.
They have 50% of X gene. And while the sickle cell have a full-blown S gene. So the sickle cell traits still have a A, which is a normal hemoglobin A in their body. So they don't get sick.
I see. Okay.
Like the full-blown sickle cell.
Okay.
They don't get sick.
Yeah. Okay. That's
So
good.
that's just the difference.
You spoke about how it affects the red blood cell. Yeah.
How it affects your red blood cells, we have a person who has a sickle cell, how it can affect your red cell. We have know that the red cell is the vehicle that help hemoglobin to carry oxygenated blood into your organs. But when the red cell is being rigid, but our normal red cell is supposed to be flexible, easy to move in any small vein. But when it becomes sickling in hemoglobin beta, it will change in a shape,
Okay.
become a crescent moon shape, like
That's
a
the
sickle.
That's
So
the
that's where the
sickle.
sickle comes from, a sickle
Yeah,
cell.
that's
When it
the
becomes
sickle.
sickle, what it does to the red cell is being cuffed. Then it will
Okay.
block the blood flow of oxygenated blood that's going into the body. And that is what caused the blocked vein is what we call occlusion, is the one that causes pain.
Okay.
And that one can lead to anything. It can lead to infection or damage of organs if we are not being treated.
Okay.
Do you know what? I want to ask this because a lot of people, I know some people have this question in mind, but so many
Yes.
people are not saying it out
Yeah.
because they don't want to be rude. So which parents caused this? Which parents should we hold accountable to making their child have sickle cell? Who should we hold? The male or the female? I mean, I think it might be the male because they cause a lot of problems for
Hey,
female.
that's not fair. That's really not fair. I don't like that.
That's my opinion.
Do you know what? It's fine. We need to kill that myth today.
Okay.
I don't know what that's about. I don't like that.
That is my opinion
Because
because men cause a lot of problems. So I'm sure they're the ones that are causing this.
we're going to have an issue
They did
today.
this to children.
It takes two to tango.
I like that.
Yes, so
I
I,
like that.
believe men and women should know themselves before they get involved in things. Anyway,
I like
let's
that.
find out what the professional thinks.
I listened to both of you, and it's very interesting. Let's see who is causing it.
Okay.
To be honest, I like what Heidi said because it takes two to tango. One person cannot have baby by themselves. They cannot produce the baby by
There
themselves.
you go.
We take two person. And that's why I explained to you that it takes two parents to actually form
Okay.
this baby. It is important, and that is why we are doing this.
That's
The
right.
Sickle Cell Warrior are doing this raise awareness. It is important before we say we're having a baby, we're thinking to marry each other. It is important we do what we call blood screening. Know yourself. A mother or a father who want to come together to become a partner to give baby, they need to actually know what kind of gene are they carrying. Are you carrying sickle cell trait? Are you carrying AC, which is another condition that have sickle cell, a trait? So you have to know yourself before you become one person. That is why genetic counseling is very important to both young people there who wanted to become a father and mother. So knowing yourself, if you know you are a carrier, and you know you are a carrier, I'm just giving an example,
Of course,
right? Both of you are a carrier, and you went to the genetic counseling, and they tell you are both a carrier, and they give you an advice that, oh, it's at risk for you to have a sickling. If you listen to them, sometimes they might tell you, maybe you need to look for a partner, different partner that match you.
Oh, dear.
Now, we're talking about love here. I'm sure that,
Everyone thinks love is blind.
yeah, love is blind.
And love conquers all.
Yes.
And it conquers
But not
all.
sickle cell. It doesn't conquer sickle cell, does it?
The decision coming to the both parents who give birth to the. If you now agree after the genetic or specialists have advised you that you are not compatible because it's a risk for you to give birth to a child affected with sickle, and you said, okay, let's go and think about it. Are you going to separate, or because you love, you want to continue your journey? I won't advise you to keep quiet. You should ask the genetic people who are counseling you, like, if you are going to be continue your relationship, what else can you do to prevent this? And you will be referred to a necessary specialist to deal with further.
Before you continue, I've got a classic example because I'm a stickler for people need to know themselves and understand themselves.
Yeah.
Why bring a child into the world knowing that they're going to have sickle cell? You know, and why are two people with sickle cell themselves coming together, or why are two people that have, you know, strong probabilities of having a child or children with sickle cell, why would they come together?
Who am I to say no to people who love themselves?
Okay.
But I do advise people not to come together, especially when they have the diseases. We advise, but it's too big more than what we are saying.
That's right.
It's sometimes I'm a big fans that advocate for sickle cell and advise sickle cell. And sometimes I listen to them, I look at the reality they are facing. There are some people I've known that they've come together and their rationale is because they have faced a lot of rejection.
Oh, wow.
A big rejection.
That makes sense.
Wow, I
That
see.
A big
Yeah,
rejection.
yeah.
And when they tell me their story and what led them to have a child, they look at, they have been facing rejection. Their age of year is going.
Okay.
They also have a woman right to have a child.
Wow.
Right? They can experience that they are a mother. But when they have faced rejection, being because they are sickle cell, they've met people with sickle cell trait, they've met people with AA, which is normal person, and where parents actually oppose them that they can't marry them because they have sickle cell. So they just think, let me marry the colleague who have the condition like me, who can understand.
Okay.
It's the parent of the person that has AA discouraging you. Why are you marrying this person? She's got sickle cell.
Yeah.
But they because they don't understand.
They don't understand.
Because they don't understand that normally AA can marry sickle cell.
Yeah, that's right.
For a parent out there, what I'm always advised for a parent out there who have a child who is a normal child AA, and your child brought a person who has sickle cell. My advice for you outside there, please look at me. You can allow them to marry, or what you can do as a parent is to advise them and support them in the sense that when they are giving birth, believe me, I am talking to you, I'm a sickle cell carrier, right? I'm living okay, and they will give birth to child like me. There's nothing wrong in it, but facing rejection will lead them to that stage.
That's right.
And I think that's one of their reason.
Honestly, I used to be an advocate for if you have sickle cell, don't get with someone that has sickle cell. But I now have a better understanding of people's situation and people's upbringing and background. So I can understand to a certain extent.
It's the that makes you understand why people do the things they do.
That's right, they do.
Because Jaden, it pisses you off.
It does. That is something I don't like. You really don't.
I think another thing I'm always tell those kind of people who wanted to come together, I also advise them, why can't you adopt child?
Okay, child adoption is an option.
Child adoption is another powerful thing.
That's where, because the kind of awareness we're trying to create. Because so many adoption facilities don't understand. So when they focus on those that can't have children for adoption, but when they understand that if they have sickle cell, they should prioritize them during adoption. That will make sense.
That is one option. Another option is surrogate IVF for you, where you don't know the person and will be a normal child. You can actually have that. That's another option you can do. I know it's costly, but speaking out, seeking help from professional will actually do the job.
Thank you. That
Thank you very much. Explains quite a lot.
On to the next question. So, when it comes to symptoms, because so many sickle cell people, they look normal. What are the symptoms? What are the complications? What is the major thing? And also, another thing I want you said, you made mention when you were talking about, when you were explaining what sickle cell is SC and SS. Can you also elaborate? Because do they have the same symptoms? Do they feel pain, SS and SC? Is it the same thing, really?
Let me go back to the definition of sickle cell. As I told you, it's an hereditary blood disorder. We have different types of sickle cell, which are SS is the severe one, and SS can be serious, a life-threatening condition, and we have SC. And the reason why we have different types is because sickle cell, like you said, is a BAME, right? It's an Black Asian hereditary country and having this sickle cell. So in ethnic generation, mostly the SC, they always say Afro-Caribbean, like African, Caribbean, Ghana, they have SC.
Okay.
Anything to do with SC or D or E, they are just a different country, because SE mostly you will see it in Bangladesh, Asian country.
Okay.
That makes sense.
The SC you will see in Afro-Caribbean, right? But they are still a sickler. But sickle cell, full-blown sickle cell SS is very, very severe, more than the SC. But both of them can feel pains. But however, some SC, SE, because they have a mild abnormal condition SE, it's not severe as others. So sometimes you might not see them in hospital frequently. And sometimes you must see the SC in the hospital. Just how each person perceive their pain when they have it, and what did they do to treat their pain? What did they know they need to do or to prevent for their pain not to trigger? But the severity one is SS.
Can I add a little bit to this? I've also heard of something called thalassemia.
Yes.
What is that? Is that separate
Okay.
to sickle cell and
So
SA?
we describe thalassemia. We do have thalassemia. No definition of sickle cell. Let's talk about thalassemia. Thalassemia as well is an inherited blood disorder that affects your red cell. But however, when we are talking about sickle cell, they produce blood. But within 10 to 20 days, the red cell of sickle cell break down and cause sickling.
Okay.
Right? In thalassemia, it affects both hemoglobin A and hemoglobin beta chain of B. In sickle cell, it affects only beta chain, hemoglobin beta chain. But in thalassemia, it can affect any chain, either A or beta. So thalassemia is a condition that affects the production and the production of hemoglobin and the red cell.
So is it worse than SS?
Yes, what's
I can say it's worst. And sometimes when I do teach in my hospital, I'm always asked this question. After I've taught all either the students or the nurses, I say, which one do you prefer to have?
Oh my.
Which one?
None.
Because are we
None.
now you have known the difference between one. One cause red cell breaking down. They produce, but they break down within 10 to 20 days. And it will cause pain. It will cause damage of organs. It will lead to infections. That is sickle cell. This one will cause a reduction in production of the either hemoglobin or the red cell, meaning when your body is supposed to be producing red cell, depend on the chain that is affected, either alpha or beta, or is it major thalassemia, then it causes the reduction, meaning that person needs to be demanding on blood transfusion. Otherwise, there is a lot of complication issue, like sickle cell have complication.
Yeah, we are learning today.
So, which one do we prefer to have?
Please answer that. Let us know if you
Let us know.
Let me know what you prefer to have.
Oh my
Thalassemia, sickle cell, or SC.
Or SC, which one?
One more question, please.
Yes.
Before we continue with this. Is it possible for a person to have both sickle cell and thalassemia?
Yes. It is possible. It is possible. And I've seen it before.
No. What?
It is possible.
No.
Let me tell you the reason why it's possible. Okay, we are talking about marriage the other time, and we said we are asking a question. The last time you were asking a question, who caused the problem?
Yeah, she said it was a woman.
Yeah, you say it's the woman.
Yeah,
no, I said it was the man.
Let me ask both of you. You don't know each other before. Let's assume you came from Mediterranean country like Cyprus or Italian, right? And he came from Nigeria, and he carried probably SS, and you carry thalassemia, probably beta thalassemia.
Oh wow!
Both of you have already fallen in love with each other. You've seen each other. You've been mingled with each other. And you are falling in love with each other for a long time without you knowing he carry SS, you carry beta. And one day, your relationship is now leading for you to have a child, or you want to become one. Obviously, this time is getting serious.
Yeah.
And now you're now revealing yourself. Oh, I have this condition. I have this. And you have spent so much year together.
Wow.
And in your mind, you are naive because you don't know how serious they are. Or probably he's desperate. He wanted to have, and he really loves you. And he doesn't see you have pain, but he normally have pain, is hiding it from you. But you don't have a pain because what you need is just for you to have a blood transfusion. And that's it. Wow. And you don't, it's not a big deal. Because probably you don't even seek more knowledge about your condition. And you come together without even seeking a help. So if you take your thalassemia and the sickle, when you bring a child, because you are a thalassemia major, and he's a full-blown sickle cell, and both of you come together, obviously, sickle cell thalassemia is your child.
Wow.
It is not wild. Do your findings.
So the child has both.
He will have sickle cell zero with the thalassemia. He will have sickle cell thalassemia.
Wow.
So when we're talking about this child coming now, and he have child, if both of you now, maybe you're pregnant and you now go to the hospital and they now diagnose both of you, are you going to choose to abort? Or are you going to choose to say, no, I'm giving birth to my baby? Or she said, let's abort. Wow. And you choose, let's have the baby.
This
No,
is
I
emotional
can't.
damage.
Emotional damage.
And
We know we're laughing, but this is a very serious.
that is a serious matter. Some people have
Yeah.
that. It's not a joke. Some
my
people have that.
gosh.
And they have sickle cell,
Wow.
beta, zero thalassemia.
Wow.
This is too much.
Oh wow. As much as I thought I knew about sickle cell, I didn't know any of this.
Let me explain further for you. When you now give birth, you both have responsibility to play on that child.
Yeah.
Because one, I'm not saying you are failing, but you have failed at one point that you didn't seek help on time.
Mm-hmm.
You fall in love before you seek help. After you fall in love, you seek help. You choose to go ahead. And you have give birth to a responsibility.
That's right.
Right?
That's right.
When the child is growing up, you are nursing your partner and the child, because sometimes your partner might have a little bit pain sometimes,
yes.
and the child as well might have pain, and it might need to go to hospital for blood transfusion as well. So you have a very big responsibility. And it's not only you, it's both of you.
Do you know what? There's
Sometimes.
another myth
Yeah.
I want to talk about. So this has made so many people have two siblings of sickle cell, 4, 5, 6.
Yeah.
So someone said to me, I think once you have it, the next will not have it. So you just have a chance of having one.
They know that's a probability, isn't it?
Yeah.
You know, when we are giving birth, it's all about gamble. When you have traits or you have the full-blown sickle cell, you marry someone who have traits. It's all about gamble. It's not advisable. People outside there hear me out. It's not advisable. But if you find yourself in that situation, seek help from professional.
Please.
Seek help from professional. That is the only way you can go about this.
Yeah.
You can do it on your own.
You know why I'm saying this? Because I've seen one of the people that we are meant to interview, one of the parents we're meant to interview, she has got 4 children with sickle cell. And sometimes they're all in hospital at the same time. They all have a crisis at the same time.
I also know identical twins that have got sickle cell too. Both of them. Yeah, it's I
and
don't
their
know how
parents are
manage.
SASAS. So they think maybe when you go the first time and that's it.
Yeah.
I have a question for both of you. Like you said, one parent have 4 kids. She and father and mother, have a big responsibility. Sometimes something led to that situation to happen, because I'm always thinking like, okay, they have first child, is being affected. What they don't know how to seek help, probably. Because I believe that if you know your rights, once in this country you have already have one child who have sickle cell, and you and your partner still want to have more baby, it is your right to use woman rights to seek help professionally, that you have affected child, you still want to have more baby. This is time the professional who are your clinician will say, oh, you and your partner can actually see somebody who are specialist genetic people, where they can do what we call pre-implementation. It's like IVF for you. So this is a nest for you, instead for you to say, okay, probably because they say 25%, let's try more. You don't know what God is bringing for you. You don't know when you have sex, what is going to be your lucky sperm or your embryo or your eggs that is going to fertilize to embryo. You don't know. No one knows. Because when you were sleeping, you were not telling, I want this by command tone.
We wish it worked like that. Right.
So I think people who are in that condition and they still out there who have a sickle cell child before, they can still go to professional and seek help, that they don't want to have the affected child. Even the affected child, if you go for help, you can use your sibling to do bone marrow transplant for treatment of the child you have already have. Sibling can help. That is if you seek out. Right? But if you don't seek out, you are trying. You have to think that your gene is very strong to produce S at all time. If you have first, second, you can relax. It's just a matter for us to speak out.
So is this the only way of diagnosing a child with sickle cell?
I think there is a different way I know about diagnosing sickle cell. One diagnosis is before you become partner, you should screen yourself. By then, when they know that you are both affected or carrier, that is one diagnosis before you proceed. Then if you don't do that, they just see your wife pregnant.
Yes.
Then there is another step that when your wife pregnant, even when you seek help, that you are now reporting yourself to the authority that you have been pregnant, to your GP or something, they will
Okay.
refer you to the clinician outside in your area of your hospital. They will now said, oh, you are already pregnant, but let's know your genotype.
Okay.
When they know your genotype, it's another diagnosis for you because you didn't seek help on time.
Initially.
So when they now say, oh, both of you is at risk to have sickle cell child, but pregnant is already there, then the next step question or diagnosis is that